Hi, my name is Marissa Warning. I'm a student nurse at the University of South Alabama, and today we're going to be performing NG tube insertion. The first thing we're going to do is we're going to come into the patient's room and verify the orders. Then we're going to check the hospital policy. They're going to perform hand hygiene, verify that this is our patient, Jaguar Jones, age 25, 1963. He's allergic to penicillin. And then we're going to explain the procedure to the patient and provide him with privacy. Then we're going to apply our goggles. We're going to apply hand hygiene again. We're going to raise the bed, lower a side rail, and begin to assess the vitals with a pulse oximeter. And I'm going to listen to the bowel sounds. I would also note that if there was any decrease in the oxygen saturation, that I would, or in the vitals, that I would stop the procedure immediately and wait until my patient was stable. Next, I'm going to position the head of the bed to high Fowler's, and I'm going to assign a cue with my patient so that I know if I need to stop. Then I'm going to begin to open my packaging. Okay, I'm going to apply lube to the corner. And then I'm going to begin to pump the 60 milliliter syringe. This is the 10, we don't have a 60. And then I'm going to apply my clean gloves. And we're going to clean the patient's nose, assess patency in the nares. We're going to use the left nair today, and we would measure our patient for where we would place, for how deep we would place the tube. Then we would mark it with a piece of tape. I'm not going to mark it, but I know that it's at the 25. And then we would provide our patient with the towel in a large basin. I would lube the end of the syringe up to 4 centimeters. And I would begin to insert with the curved side down, encouraging my patient to take sips of water and swallowing while I do. And I would make sure that I have him lean his head back, and as I reach the end of the nasopharynx, I would have him lean forward, and I would begin to rotate my tubing as I inserted it 1 to 2 inches at a time. Now that I've inserted it to the 25 mark, I'm going to temporarily secure it to the cheek. We're going to temporarily secure it, and then we're going to check the placement in the back of the throat with the tongue depressor and the pen light. As I was inserting, I would make sure that I noted any coughing or decrease in the O2 saturation or any signs that could mean respiratory distress, and if I did, I would stop immediately and pull back into the nasopharynx and wait until my patient is more stable to continue. Then I would assess the correct placement in the stomach. So I would draw out and note the gastric contents. I would assess the pH of the contents to make sure it's in the correct location. And if I needed to check again, I would order an x-ray. So then I would secure it to the nose. I would remove the temporary, use a skin prep, secure it to the nose, kind of in a more correct fashion, but it's supposed to be floating. Okay. And then we would apply a second piece of tape noting the date, time, and who has placed it there. And then we would make sure that we pin it to the gown. We would apply suctioning through this point here. And if we weren't suctioning, we would close it with the pigtail. We would want to make sure that we keep the pigtail above the stomach at all times. And then we would, I can't keep it up there right now, but I would clean up my supplies. remove my clean gloves. I would lower the bed, raise the side rail, make sure that the head of the bed stays up at least 30 degrees, and provide my patient with a call light in case they need anything. Then I would return to the nurse's station to document. I would document the type and size of the NG tube, the time that it was inserted. We would document how the patient has tolerated this, the location, which is the left nair. We would document the suctioning, if it was done, the secretions in the gastric contents. We would also document the color of that and the amount that we pulled out and the characteristics. Then we would perform hand hygiene, and we would begin to remove the tubing. So I'm going to then come back into the room, check the orders again, perform hand hygiene, apply my clean gloves, we're going to then remove the tape, keep the tubing, encourage the patient to take a deep breath and hold as I remove the tubing. Okay. And then I would throw it away. I would document the amount of drainage, I would just document, and I would also perform oral hygiene on the patient. And that completes my nasogastric checkoff.